Hello everyone! Luzon, Visayas at Mindanao. I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine physician, and you are watching DANGPANAN, a Doc Shi TV live health talk series. If this is your first time watching, we do this training regularly and simultaneously in Facebook and in YouTube, Doc Shi TV. So if you're watching from YouTube, please click that subscribe button and turn on that notification bell for you to be notified on future videos. If you're watching from Facebook, click that follow button and share away. The goal of this program is to get in touch with you, modern Filipinas, to various social media platforms to empower you to take charge of your health through correct and science-based information. DANGPANAN, a Bisaya term for shelter, is chosen to be the name of this program because I want to share this shelter of comfort and good education to you, my dear viewers, through a platform that is accessible to all. Welcome to another educational health talk. And what's more, you do not just learn. Lucky viewers will also get a chance to win a free online consultation coupon. So, stay tuned till the end because you might be today's lucky winner. So invite your friends by typing their names in the chat box and click that share button. Don't forget, ako ang inyong DANGPANAN, hashtag DANGPANAN, DocShi TV or hashtag DDS TV.
DANGPANAN, kabahin sa panglawas o relasyon. Doc Shi Armero.
Hello everyone, Luzon, Visayas, Mindanao, and even outside the Philippines. Ito na naman po ako. I'm Doc Shi Armero and you are watching DANGPANAN, and this is our regular live health talk series. So good evening sa ating watchers from the Philippines. Good morning, good afternoon sa nasa ibang bansa. I hope you can type in the chat box saan po tayo nanonood para po ay mag-greet namin kayo. But before we do that, I would like to again encourage everyone to join us sa ating walk with me. It's a walk, an encouragement for everyone to walk and move to move. Ayan. Okay. Hi, may nag-text. Hi, Ate May. Thank you very much for being with us. Happy birthday. Happy birthday to you. Ayan, from Compostela. Thank you for being with us tonight. So, without further ado, I would like to show to you first yung video na gawa ng anak ko to show you ano ba ang walk with me. Ano ba yung move to move na yan. So, it's regular. I'm gonna be posting po saan ang next because doon tayo mag-gather and then you will be able to talk to me during the walk. So ito po. This is how it looks like. Ayan. So, ganun lang po. Ganun kadali ang ating walk. So let me know kung medyo naglalag ako para magawa ng paraan. Ayan, sabi ni Ate May, thank you for the greeting. Of course, I'll see you over the weekend, ate. And hi, Lorna Cueto, watching from Kalagatan, Batangas. Wow! Welcome to the program. Ayan. So, it seems na ready na mag-share ang ating guest tonight. And I'm very proud, no? Ako ay isang napaka-proud na mentee. Oh, ayan. Sabihin ko na, baka sabihin niya mamaya, batchmates kami. Hindi kami batchmates. Mentee niya po ako. Siya ay isang napakahusay na teacher, na professor. Napaka-passionate sa kanyang field. He is the immediate past president of POGS Cebu. And nakikita natin siya dito sa DANGPANAN kasi nag-guest na siya sa atin about cervical cancer. Kaya lang this time kasi may mga updates tayo. Also, it's a privilege to have him with us tonight kasi he is co-chair ng ating National Committee ng Ang Pangako, Puksain ang Cervical Cancer. O, ayan. So, ito ay isang testamento ng kanyang pangako na pupuksain ang cervical cancer na kahit busy ay may panahon para mag-guest dito sa DANGPANAN. Magandang gabi po, Dr. Pherdes Galbo.
Good evening. Maayong gabi. Magandang gabi. Ano pa ito? Magandang umaga, magandang tanghali, ano pa dyan? Nandito po tayo sa YouTube sa DANGPANAN. Thank you, Doc Shi, for inviting me here. And hello, everybody from all parts of the world. Luzon, Visayas, Mindanao, Kazakhstan, Pakistan, Indonesia, whatsoever. We are here. Good evening, good morning, and good day.
Ayan, thank you very much for the very warm welcome ng ating audience, Dr. Galbo. So, before that,
hindi po kasi kami batchmate. Ahead po kasi siya si Doc Shi sa akin. Siya po kasi yung mentor ko ng yung lifestyle medicine. Siya kasi yung dito ko talaga with regards to lifestyle medicine. So, thank you for inviting me here, Doc Shi.
Ayan na. So, sabi ko na nga. So, Doc, kung napapansin ng ating audience, nakapula po tayong dalawa. Ang ating mga pangalan ay nakamarkang pula. Ano po ba ang Scarlet May at bakit natin pinagdidiriwang ang cervical awareness and we call it Scarlet May?
Okay, so for everybody's information, May is a cervical cancer awareness month. Dito kasi sa Cebu, iba yung tawag natin. Sa America and other parts of the world, they call it teal ribbon. Okay, pero dito sa atin, we have our own sign or the ribbon with regards to cervical cancer awareness, yung tinatawag na yung scarlet. Bakit scarlet? Diba ang scarlet is red, orange, or red like that? Okay, because yung presentation kasi yung symptoms kasi or presentation ng cervical cancer is blood. Okay, blood. So bloody yan ang presentation. That's why we call it Scarlet May. Iba naman kasi yung red, iba na February yung red eh. So that's why you change it a little bit, parang social eh. Parang may kanong American something like that generations na Scarlet. Okay, so that's why tinatawag namin yung Scarlet May. So Scarlet May, this was promoted by Dr. Pañares, one of our mentors, regarding it was about, I think, 15 years ago. They have this move to change the May cervical cancer awareness to Scarlet May. Okay, so yung second question mo is yung lantern walk. Okay, so lantern walk, meron kasing tayong I was finding ways how to increase the awareness regarding cervical cancer. Ang good thing kasi yung sa breast cancer awareness, meron silang tinatawag natin na moonwalk. Okay, so I was thinking, how about something that we can identify the awareness with regards to cervical cancer? So that was in 2010. So I was pounding how to make this better awareness. So I was thinking, how about making it a lantern walk? Okay, why lantern? So for everybody, this was I made this idea 2010. It's already about having our 13th anniversary this year, this May.
How are you?
Okay, so yun ang thinking na. So that's why I brought up with the group, with our group, together with Rafi, with the Vicente Soto staff,
Mm-mm.
especially Dr. Amorin. She was one of my what you call my right hand during that time when I made this idea. Uh, why lantern walk? Anong ibig sabihin ng lantern? What is lantern in Tagalog, 'di ba? Ilaw. Okay?
Ilaw.
So ilaw means ilaw ng tahanan. 'Yun po ang
Mm-mm.
ibig sabihin namin 'yun. Yun ang yung ang parang pinpoint namin bakit lantern, bakit ilaw, bakit 'yun ang parang sa it represents the mother of the family or of the house, like that, because we have to make sure that the mother is okay. Okay, if the mother is sick, yung ilaw ng tahanan is sick, definitely it will affect the whole family. So that's why we have to make sure that the ilaw ng tahanan is always yung
Healthy.
up to beat, or with regards to health and well-being. That's why part of this will be yung lifestyle change na i-talk ni Doc Shi later on regarding that. So that's why we have the Scarlet May and Lantern Walk is a cervical cancer awareness campaign of Cebu. It's only here in Cebu. Okay. So walang Scarlet May sa ibang it's not found in any other countries, or what's not found in Manila. We only have it. I keep asking them regarding sa society na sa Manila. We have to have something to have an awareness, but unfortunately, they didn't get that idea. So we have to push with our idea in Cebu. That's why we in Cebu are always on the go, one step ahead for any advocacy, especially with regards to cervical cancer.
Wow, congratulations, Doc. I'm so proud to even be talking to you about this in this platform. Ikaw pala yung nauna sa ating move sa Lantern Walk, which will happen. I-plug in na po natin para
Oh.
ulit-ulit.
Sorry. So, sorry. So yung Lantern Walk is gagawin natin this Sunday. Together with this cervical cancer awareness program natin. It will be held in SMC side, Cebu City. So it will be from 4:30 p.m. So we have a walk, we have a drum and bugle and all those things. Maraming mga involved nito, mga cancer patient survivor, yung mga doctors, yung mga NGOs, everything that is connected with regards to awareness. So we are walk from yung malapit sa outside Pedro Calungsod Church, may yung street diyan tayo mag prepare, then patungon tayo sa loob ng SMC side. Unfortunately, if may bagyo or if may ulan during that time, so we have to move to start the walk inside the mall. That will be in the Mountain Wing View Mall, one Mountain View Wing View area. Then iikot tayo sa loob ng SMC side, then punta tayo sa Cube Wing, doon tayo gagawin nating program. So it's not just awareness. So we have program with regards to how to detect cervical cancer. Meron tayong lecture about yung the truth about nutrition against cancers. Okay, in general, cancer. So may mga guest lecture tayo niyan regarding anong kakainin mabuti, anong yung tinatawag natin na mga herbals, kung totoo ba yan o hindi. At saka may lecture tayo, yung lecture on anong ginagawa ng DOH, ng government natin, to help those in having cancers, whatsoever cancers. May mga programs tayo para alam nila what to do if there's somebody in the family will have that, parang sa saan pupunta, saan makahingi ng tulong, kung anong ginagawa nila para sa kababayan natin. Yun.
Wow. So I hope yung mga available sa Sunday, join us. Kasi andun si Dr. Galbo sa Sunday.
Oo.
So,
alam niyo ba mga kaibigan, okay? May yung sa program namin, yung isa sa guest namin na yung kakanta at sasayaw at lalatay ng alambre, ano ba yung alam mo ng alambre? Yung barbed wire, si Doc Shi. So you have to see paanong gagalaw si Dr. Shi sa alambre, yung barbed wire, para tingnan natin it's only here in Cebu that yung si Doc Shi mag-presentation. Okay? Ano, song and dance ba 'yun? Anong title niyon?
alam nyo ba ako ay naka-yes dahil para sa inyo, para mag-guest din si Dr. Galbo dito. So wala akong magagawa, no? Nag-yes talaga ako. Thank you, Dr. Galbo, for saying yes.
No, it's not like that. Si Doc Shi kasi, we put it this way, she has all the talents with regards to ganitong klaseng platform. That's why she is the first person I think of for anything with regards to emceeing. Especially, thank you, Doc Shi. I'll see you on Sunday. Okay.
So ayan
So
na.
see you on Sunday, everybody. Doc Shi will be there. So please wear something red. And we'll see. We have the Lantern Walk, the Cervical Cancer Awareness Campaign.
So ayan na. So we will go direct na sa slides niyo po. Kasi baka naubos na ating oras sa pag-endorse mo sa aking paglatay ng alambre. Okay, so floor is yours, Doc.
Okay, so again, inviting everybody. So we have our Cervical Cancer Awareness Month. Yung tinatawag natin Scarlet May, ending cervical cancer within a few generations. Hopefully, we're hoping that we can make it. So it will be on May 28th, Sunday. Hopefully, hindi ulan. Hopefully, dadaan na yung bagyo. It will be in lower ground floor, Cube Wing, SMC side. We'll have our lantern walk. We'll see you there. Okay? So we'll go now to Dr. Shi requested regarding new trends and updates on cervical cancer. Okay, so ito talaga yung Cervical Cancer Awareness Month. That's why we have to talk about this. So we cannot, before going to yung screening natin, okay, we have to go back to understand. Gusto ko maintindihan yung ano yung cervical cancer na pinag-usapan natin. Okay? So yan ang cervical cancer is yung lang pong may cervix. So yung lalaki walang cervix po yan ha. So if ever may cervix yung lalaki, hindi yan lalaki, babae yan. Okay? So yun lang po ang may magka-cervical cancer. So yung cervical cancer yun po yung sa dulo po ng matres, okay? Yung makita po sa pap smear po yung pagtingin sa kwelyo ng matres, yung speculum, yun po ang saan yung kwelyo ng matres natin or cervical cancer or yung tinatawag natin, sa Bisaya, I forgot the term. Okay, anyway, so yun ang saan po mangyayari ang cervical cancer. Usually, it occur in yung sa exocervix niya, yung saan dadaan yung baby, yung regla, doon po yung kwelyo ng matres. Okay. So yung cervical cancer, mga kaibigan, mga kapatid, mga kababayan dyan nakikinig, usually hindi yan automatic na mangyari kaagad. Okay. Some of them will, yung infection to yung mangyari yung cervical cancer, it will take sometimes 10 years or 30 years. But mind you, okay, may mga studies kasi lately na may mga ibang klaseng cervical cancer yung ang bibilis na mag-develop. Some of them will develop 1 on 10 years. Okay, so that's why we are very careful with regards to screening for cervical cancer. Hindi po tayo na kampante na ngayon. We have to be one step ahead. We have to be thinking of this is a possibility that this presentation yung patient is probably cervical cancer. Pero good thing nito, hopefully na yung mag-develop sometimes 10 years, we have that opportunity na ma-screen natin yung pasyente. Ma-check natin kung may problema ba. That's why, pag-usapan natin na regarding screening, hindi po natin mag-screen o hindi tayo mag-pap smear kung may mangyari na or may symptoms kayo. Kailangan tayo mag-pap smear maski wala kayong symptoms para just for general check-up po ang pang-ibig sabihin yan. Okay,
Doc,
bakit
Sorry, Doc. Before po tayo mag-proceed, yung ibig sabihin, in other words, hindi ka nagigising isang umaga, tas may cancer ka na. Ibig sabihin, na-develop yan ng medyo matagal-tagal na? Tama ba?
I agree with you. Yung ibig sabihin, hindi yan yung katulad ng COVID or yung sipo na after a few days magka-cervical cancer ta. Usually, it will take 1 to 10 years or more than 10 years or 15 years yung development mo pag-infection kayo hanggang mag-develop ng precancerous lesion, hanggang mag-develop ng cervical cancer. Okay? Marami kasing factors that we'll talk about yung factors. Bakit hindi yan automatic? That's why hindi po tayo kampante kung may ka-infection tayo, may problema, kailangan po kayo ng annual check-up talaga ng doktor. So we have to talk about yung bakit magka-cervical cancer. Yung bakit ka ganyan? Okay, so we'll be talking about yung ang main reason talaga bakit mag-cervical cancer is yung infection ng HPV, okay? Human papillomavirus, okay? Hindi yan, yung HPV natin dyan, hindi yung hair is vanishing, ha? Iba yung klaseng hair is hair papa vanishing, okay? So yung HPV po is a sexually transmitted infection. Ang problema lang yan, it's a very common infection po, okay? Usually, about 50 to 80% yung anybody yung babae magka-infection talaga ng HPV virus once mag-start ng sexual contact. Okay? So once mag-gerger po kayo diyan, may chance na po kayo magka-HPV. Okay? That's how common it is. Pwede pang sabihin ng gerger dito, hindi ko alam.
Pwede
Basta
naman, Doc.
PRC.
Ay, parental guidance
Okay.
naman tayo.
I think that's a general term. Okay, I just have to make sure baka ma-edit tayo lang bigla dito. Okay, anyway, just for everybody's sake, yung gerger yung tinatawag namin, yung ibig sabihin yung sexual contact po niyan, okay? So, it's a very common virus as mentioned. Usually, in 1 to 2 years time, magka-infection ka, mawala yan sa system mo, okay? Kasi pag maganda yung healthy lifestyle mo, yung immune system mo at other factors, yung hygiene mo, usually it will just be cleared out by your immune system. Okay. Unfortunately, about 10% or less than 10% yung infection natin is mag-persist, yung magpatuloy talaga siya. Yun po ang concern namin, yung tinatawag nating persistent infection. So yun po ang malaking chance na risk factor magka-develop ng cervical cancer. Okay, kaya nga kailangan natin magpa-healing, magpa-check up para masigurado tayo na wala tayong infection yan. Okay, again, it's a very common infection na makuha sa babae once mag-start ng contact, about 50 to 80% during your lifespan, magka-infection talaga niyan. Kaya that's why we have to make sure that walang yung later side effect with regards to infection of human papillomavirus. So as mentioned again, yung general yung incidence ng cervical cancer sa Philippines about 7,500 per year. That's how the most common yung incidence natin. Yeah. Even in the 2020 Philippine Cancer Facts and Estimate, same pa rin yung level ng incidence ng cervical cancer. Ang problem lang yan, yung census talaga natin sa Pilipinas is not always 100% accurate. Marami kasi tayong mga kababayan na hindi na nakarating ng hospital, hindi na na-check, yung namatay na lang dahil sa bleeding, hindi natin alam kung ano. There is a big possibility yung 7,500 na mention ko is just a small part of that or 2 or 3 times pa yung total incidence talaga na cervical cancer. That's why we have to be worried with regards to that. That's why yung cervical cancer kasi is yung second most common cancer sa babae after the breast. Okay? So, yung sinasabi na incidence starts at 35 years old, yung cervical cancer. But mind you, not always like that. Okay? We have patients due to, I don't know, probably yung early premarital sex, yung culture and all those things, we are finding patients that are more younger already. Yung mas bata-bata. Okay? So, based on my
How old pinakabata sa experience niyo
based
po?
on my experience, yeah, my youngest patient was 21 years old. She was from Dumaguete. Okay, so that's why that worries me very much because in general, yung incidence ng cervical cancer is at 21 years old should be less than 1%. That's how very low it is. Okay, that's why we are worried because of the changes in the culture already of the young Filipinas. Parang mas expose sila sa virus, so it becoming younger already. Okay, but also I have to tell everybody that it's not always younger. Sometimes the incidence is also getting older. Okay, meaning it's not always the young population na magka-cervical cancer. Old population also, yung menopausal women can still have cervical cancer. That's why we are not just talking to you, yung mga nakinig ngayon. You have to tell this also to your parents, to your lola, that it can happen to them. Okay?
Agree.
Hindi ko alam kung nagpa-practice pa ba sila ng gerger or whatever, but it's still a risk factor for them. Okay? So ang problem kasi nito is yung hi Ma'am Laura. So from
From
Dumaguete.
Dumaguete
Thank
siya.
you for
O,
being here.
nalilimutan ka.
Oo. Okay, so ang problem kasi nito yung cervical cancer is that because we don't have, wala tayong yung national, yung guidelines or national screening test with regards to cervical cancer, wala tayong libre, yung automatic pupunta lang pasyente, at yung wala tayong yung mga pasyente natin hindi that aware regarding cervical cancer screening, yung pap smear and all those things. Kaya we diagnose din almost always 70% of the time late stage na. Late stage means yung stage 3 na, yung masakit ng balakang, masakit ng puson, grabe ng bleeding. That's what we are worried about also. And sometimes during na diagnose sila like yung 35, 45 years old like that, ito kasi yung tinatawag nating prime years. Yung dinevelop pa niya yung family niya. That's why we are very taking care. That's why we have signifying that the lantern walk is because of yung ina ng bahay natin, yung ilaw ng tahanan natin. Okay? Unfortunately kasi, Doc Shi, nito, pagka magka-cervical cancer ka, as high as 50 to 60%, once you're diagnosed with cervical cancer, you will die in 5 years. So that hurts me, okay? That's why we have to find ways, we have to make awareness regarding cervical cancer, that it can kill Filipinas or can kill women, okay? May
Dok,
mga
ibig ba
studies.
sabihin, ay sorry. Ibig ba
Yes, go ahead.
sabihin ganun siya ka-aggressive? Ang 56% na sinasabi mong will die in 5 years, does it tell us na aggressive ang mga cervical cancer?
We'll put it this way. Yes, part of that. But usually, ang problem kasi bakit mamatay sila is that they were diagnosed late stage already. Yun talaga ang main problem. As mentioned, almost all stage 3, stage 3B na yung pumunta na sa balakang yung extension ng bukol. Kaya na mahirap talaga maski gaano na yung kagaling. It's not always like that. There are still things in cervical cancer that we don't know. Bakit itong exactly this patient, magandang response, ito hindi magandang response. That's why we are still very many things in science with regards to cervical cancer that we don't understand. That's why we have to find ways, at least for the moment, yung awareness, yung cervical cancer, yung awareness yung kailangan magpahiling or magpa-examine or magpa-check up, not kung may mangyari na sa iyo or may naramdaman kayo, maski wala kayong it would be better na magpa-check up talaga. Yung parang general check up rin ba? Yung check ng breast, yung high blood, yung sugar, all those things, included na yung screening ng cervical cancer.
Cervical cancer.
Okay?
Doc, kung na-diagnose ang pasyente ng stage 1, ano bang chance of survival niya? Para medyo kasi natatakot sila na pag sabihin, stage 1, mamamatay na ako kasi aggressive ang cervical cancer. So, gusto nating baguhin yan na mentality na paano pag early na diagnose at nagawa ng paraan, ano bang chance of survival?
Okay. So, as mentioned, any cancers for that matter, basta lang ma-detect early, especially stage 1, the chance is almost always 90 to 100% chance na gagaling talaga kayo. Yun talaga ang good thing ng early detection. That's why kung early detection, yung na-check sa pag-pap smear, yung pre-cancerous stage pa yun, yung hindi pa parang tinatawag nating gas-gas pa lang ng Quelios matres, the chance of cure is 100%. We're very sure of that. Kaya lang ang problema, we have to tell the patients that to check up early. Yung hindi wala pa kang nararamdaman, magpa-check up ka agad. Okay.
Okay, so, since nasabi niyo po yan, I would like to thank, kasi may mga patients po ako na nagsabing naka-attend po sila nung nung VIA cervical cancer screening. Ayan, so si Dr. Galbo po ang yung andon na pag may makita, anong ginawa niyo, Dr. Galbo, sa mga nakitang may precancerous lesion na? Sige po.
Okay. So yung mga outreach tayo noon, kasama na din si Doc Shi sa outreach. Thank you, Doc Shi, for being there. It was I think last Sunday ba yun?
Tama.
Last Sunday. That was in Mandawi. So we were thankful again for the LGU in Mandawi, together with DepEd. they have coordinated us with regards to cervical cancer. So kung may gas-gas tayo, tinatawag namin yung precancerous lesion already, or tinatawag namin yung VIA, visual inspection acetic acid, mag-positive siya, automatic tinitreat ka agad namin. So ang treatment namin, yung tinatawag na yung cryotherapy, parang i-freeze namin yung kwelyo ng mattress mo kung saan yung may abnormalities, yung may puti, at saka good as 90% sure tayo na you're cured already. Okay? Or may tinatawag tayong thermal ablation, yung by battery operated na yung parang ilutuin natin, lutuin? Hindi ko, parang i-burn natin yung kwelyo ng mattress para mamatay
Nasunog.
yung abnormality o sinusunog natin. Pero yung treatment na yun, hindi yan masakit na, hindi sisigaw yung pasyente. A little bit of discomfort lang. Okay, parang may mainit ng konti or may tingling sensation, but otherwise, it was a tolerable treatment nga kailangan talaga natin with regards to kung may positive tayo na makikita. And we have plenty of that. So, last Sunday, we were able to screen about 400, I think 427 or 447 na patients, and I think 21 of them have positive VIA or positive findings that we treated with cryotherapy or thermal ablation. And unfortunately, during that batch, we saw one patient that had cervical cancer. Okay, so in 437 patients, 20 were pre-invasive and one was positive for cervical cancer. So that's why we are that range already is it's high enough nga in one
Yeah.
in 400 babae may cervical cancer. That's very high already. So that's why we still have to promote regarding that. So may probably next year may outreach si Doc Shishi tayo. So we'll be under we'll have that outreach Doc Shi, so we'll plan it for next year, okay? So it will be Doc Shi goes cervical cancer screening with Dr. Galbo. Okay? So we'll have that. Okay? Kung nakikinig tayo, so we can do that. So we can have it so we can first have our inauguration screening in the hometown of Dr. Shi. That will be in Bohol. Saan gayon
Yes.
tayo sa Bohol?
Albuquerque, Bohol.
Okay, Albuquerque, USA. So we'll have that first.
Calamay.
Yeah. Okay. So all those from Albuquerque, Bohol, will have please remind Dr. Shi that we'll have our first Doc Shi cervical cancer screening outreach program May next year. Okay, Doc Shi, pagayan
Okay.
sa wato kailangan natin. We have to push for
Yes,
that. Okay,
next year.
and
Okay.
definitely if we can invite other groups that to help us during that time. Probably 10 to 15 of us will be enough to do the screening. We just have to coordinate with the meron tayong district hospital doon or primary
Meron
hospital tayo doon.
Galyares, Doc, is a training hospital in Bohol.
Yeah.
Oh, so we can always coordinate with them.
Yeah. But it would be better na doon tayo sa hometown, yung sa Albuquerque.
Oh,
Kasi
sige. Kaya yan.
ang style kasi natin is I would prefer to give back to where you grow or yung nag-shape you as a doctor. It would be better to go to serve back your community. Yun talaga ang some of our yung motivation to volunteer.
Yeah. Next
Okay.
year.
So let's go now. Okay, HPV is easily transmitted. Yun talaga, as mentioned, it's a very common virus. Okay, as mentioned, 50 to 80% during your lifetime, anybody of us once mag-start ng sexual contact will have the infection. Okay, the virus can be transmitted through skin to skin or genital contact. Yung hindi naman kailangan penetrative, yung pa-dapit lang, pwede na yan. Penetrative sexual intercourse, not necessary to have the infection. And the problem with HPV infection is that condom is not 100% effective or not 100% protective. Why? Bakit? Okay? Because yung protection talaga ng yung condom is sa dulo ng yung genitals ng lalaki. Yung sa gilid kasi it can still transmit the infection. Yun ang problem natin yun. Okay? Anyone who is sexually active is at risk of exposure to HPV types that causes cancer. So, mention dito yung HPV types. So, we have about more than 150 types of serotypes, yung tinatawag ng types of HPV that causes different types of infection. But about 15 of them are directly related to development of cervical cancer. But some of the HPV infection not causes what you call genital warts. Yung mga anong taga genital warts, yung parang warts. Basta sa warts, yun yun ang it's parang
Kalunggo in
kapatid
Bisaya.
yan. Oo, yan ganun. Ah,
Hindi ko alam sa
kapatid kasi
Tagalog.
yan sila, mga group of family yan ng HPV. Yung iba cause ng genital warts, yung 15 of them causes the cervical cancer. Okay, even as mentioned, even dead cells shed during intercourse can contain virus and remain infective for days. So that's why during this time, during this event, during this infection, one of my advocacies that you have to be what you call hygienic with regards to use
Mm.
of your personal belongings. Okay, so please do not share yung mga towels, yung mga yung underwear. Hindi pwede mag-sharing yung underwear, ha, kasi you never know, you might be sharing also the virus.
HPV.
Okay, oo. Yeah. So yung mga lalaki, wag niyong gamitin yung mga
Panty.
okay. No, I have to be Kwan. I have to be. It's sometimes you are not thinking of it because you don't see it. Okay,
Yes.
but it can happen. It can be transmitted through those things. Okay, that's why don't share it with your kids or whatever. Yung personal things, yung towel is your for you only. Okay. Let's go. So this is how the natural history of the infection. Okay, once you have infection, it's not always as mentioned. Some of them will be kanang eliminated by immune system, pero some of them what you call persistent infection. Once you have persistent infection, the development to a precancerous lesion will be take about 1 to 10 years. But some of them go directly to cancer already. That's why there are things that we don't understand why yung iba precancerous, yung iba in a short time, in less than 10 years mag-develop kagad ng cervical cancer. I one of the I mentioned that 21 years old, we reviewed that case, why this happened. She had the first sexual contact at I think 16 years old, and I think she had 2 or 3 partners in her lifetime. So 16 to 21, so that's about 5 years from start of contact to development of cervical cancer. So that worries me. Okay, that's why we have to make sure that everybody is have screened and have protection also. Okay, so next will be the ito ang nangyari last ito
Ayun,
ang
may
nangyari
slide
last.
pala tayo eh.
Oo, yung free cervical cancer awareness natin, yung screening at saka yung treatment natin. Okay, so we have it at the DepEd Mandawi, what you call that, Comprehensive National High School, yung DepEd na ng building doon. At why I'll just give you a brief why don't natin ginawa. Okay, I have to share with everybody that why I chose the DepEd that main uh, main patients that was screened this year was about if I have 10 cervical cancer patients, 2 of them are teachers.
Teachers?
So
Oh my
parang
God.
I have to find ways how to eliminate that chances regarding development of cervical cancer with teachers. It's not that teachers are high risk, but unfortunately, I asked why. One of the reasons is that hindi nila may annual screening sila, yung kasama ng DepEd.
Opo, opo.
Hindi yan kasama eh. Parang isa lang yan ng options. Okay, I think
Optional
the
ang POPS.
yeah, the requirement for annual, I think, is just chest X-ray, urinalysis, I think. Yung iba, yung breast exam, yung mammogram, yung especially yung cervical cancer screening, yung pap smear, optional yan. Ang problema kasi is that hindi yan hindi yan sinasama ng mga teacher natin kasi optional lang na, hindi naman kailangan, wala naman silang naramdaman. Yun ang problem kasi. So it hurts me na about 2 in 10 of my patients are teachers because we will not be like doctors if there's no teachers. We have to tell that to the teachers that we owe that to you. Okay, so that's why it's been, I think, 2 years ago. I keep on talking with DepEd hierarchy in Region 7 regarding the cervical cancer screening that we will be offering them. Unfortunately, during the pandemic, we have to find ways. And it was now that na push through talaga yung pinaprioritize namin yung mga teachers in Mandawi. Hopefully, we can do that again in our, I think, target population was Mandawi. Next is Danao. We'll have to find ways how to go about it. But I was thinking yung kwan kasi baka maliit lang yung number ng teachers, pero sinasabi ka rin about 15,000 teachers for for Cebu. Oh my God. So we'll have to just step by step lang yung prioritize natin yung mga teachers. That's why thank you for those na nagpunta ng kuan ng mga teachers sa Mandawi at we were able to serve them properly during that time. Okay? So that's the story behind bakit DepEd building ang nakuha natin sa. So again, thank you LGU Mandawi, the LGU City Health Office, the officers yung so officers natin diyan, yung staff natin, yung DepEd. We were very thankful for the coordination. Okay. So again, next year it will be in Albuquerque with the cervical cancer screening mission together with Dr. Galbo and friends. Okay. So so ito po yung mukha ng kwelyo ng matres. Okay, ditong sa taas po yung tinatawag natin normal cervix, yan po ang saan lalabas yung baby, yung regla, and all those things yun po. Pero once may mga tinatawag nating gasgas dito sa lower part, left lower part, start na yan po yun ng gasgas. Okay, these are already pre-cancerous lesions. Ito po yung makita namin yung sa paggawa na ng VIA or screening, pap smear. So makita namin duda na kami na there's a big possibility there's already a problem or a disease regarding this. Okay? So yung nakikinig diyan, if you want to see, pwede niyong tingnan yung cervix yung mamaya, pero mahirap yan. Kaya kailang mas better pang pupunta kayo ng doktor para ma-check ng doktor. Hindi po kayo, hirap po kung kayo mag-check. Okay? So, we have to talk again, bakit magka-cervical cancer yung mga pasyente, okay? So, let's go back to what you call risk factors. Bakit iba ito, magka-cervical, ito naman, hindi naman. So, these are what you call high risk or risk factors in development of cervical cancer. So, first is yung young age of sexual debut. So, kung may debut tayo, may sexual debut rin pa yung iba. So, yan po. The earlier nakita namin na yung sa studies, so the earlier kayo na nag-start ng sexual contact, mas increased chances po kayo na makuha no, yung virus. Kaya mas increase po yung chances yung magka-cervical cancer. So, we compare those nag-start ng contact after 20 years, below 20 years old. So, nakita talaga na mas high risk talaga yung below 20 years old. One of the physiologic reason of that is yung cervix kasi natin is nag-start pa ng parang development during that time, during the teenage, okay? Teenage years. So kung mag-development yan, tapos may exposure ng virus, definitely mas increased chances na ma-incorporate siya ng cervix at mag-develop ng abnormality. Excuse me. Okay. So again, another one is multiple sexual partners. Okay. So the more hindi po ito mag-apply the more the merrier, ha, hindi po ito. Okay, so ang problem ito is pag more exposed to different partners, okay, so the more chances you'll have the infection and the HPV. Okay, but I have to share what you call an observation. Just an observation is that most of my patients don't have what you call, doc, isa lang po yung partner ko, isa lang yung husband ko pa lang. Okay, so yun ang problem is that sometimes but not always like that. Okay, yung partners may history of different partners also, probably before kayo nagkita or before kayo nagmeet, ganon, so may exposure na sa iba, so that virus, what you call, parang carried over ba, parang subclinical infection na matransmit sa partner. Ang problem kasi sa males is that hindi namin makita yung any changes sa yung sa genital parts nila. Rarely na makita yan. Because of some of them, yung virus kasi sometimes mamatay yan sa exposure, regular exposure lang ng air. Okay, some of them mamatay. Pero kaya yung sa dulo ng yung sa genitals ng lalaki, probably there's a harbors yung subclinical lung infection. So even though we cannot answer kasi kung active ngayon na yung partner mo, but definitely probably there's history long time ago before kayo nakita na carry na yung infection. So please huwag niyong awayin yung husband niyo. It's not always like that.
May iba ka, may ganun na.
No,
Pagkatapos na.
wag po. Hindi po, not always like that, ha? It's not always like that. Okay. So another is yung high number of pregnancies. Okay. So nakita kasi pag mag-vaginal delivery, yung kwelyo ng mattress mo is sometimes yung magasgas or ma-traumatize during delivery. So if you during the repair of that cervix, kung may presence of HPV infection, definitely ma-incorporate yan ng cervix. So the more chances na mag-persist yung infection. Another is yung current smoking. Okay, current smoker. Okay, so we all understand, alam natin lahat yung smoking can cause lung cancer. Okay, so definitely hindi naman mag-smoke yung sa baba, pero nakita namin,
Okay.
you never know. Okay, you never know. Baka nag-smoke yung sa baba. But otherwise, yung nakita kasi namin, yung nicotine byproducts, yung mga ganun is yung nakakause ng cancer sa lungs, makita rin yan sa discharges ng kwelyo ng mattress. So, kung makita nun, so yung yung immune system ng yung kwelyo ng mattress, hindi rin madamay rin sa nicotine products. So hindi maka build up ng protection or defense mechanism ng kwelyo ng mattress. That's why you have as much possible hindi po kayo mag-smoke, or sometimes as mentioned yung second-hand smoke, as much possible wag po kasi we definitely know it can have impact with regards to your immune system. Yung term dito na long-term use of oral contraception, this is very small chance lang related to this, but ang purpose kasi ng contraception, yung OCP, yung pills natin, is to prevent pregnancy. Okay, so pregnancy is not always it has its own risk. Okay, so that's why the advantages of using pills is still outweighs the risk of development of cervical cancer. That's why if the need arises, we still have to promote contraception to prevent pregnancy, because pag marami kayong pregnancy, the more other complications will set in. So as much possible, spacing or yung ilan lang na kids ang planned family pala yung tawag natin nun. Okay? And also, definitely, HPV is part of what you call sexually transmitted infection. So, pag may history po kayo ng STI or STD, yung mga discharges like that, more likely you are exposed also with HPV virus. So, that's why parang connected ito eh. Okay? So, let's talk now about signs of cervical cancer. Okay? Pag mag-start pa lang yung cervical cancer, yung tinatawag precancerous stage or yung gas-gas pa lang, wala po kayong nararamdaman. Okay? Wala po kayong simptoma, walang discharge, wala whatsoever. Kaya that is the best time na kailangan kayo magpa-check. Kasi once na may, as mentioned, once kayong may symptoms, yun pa lang kayo magpa-check, baka malala na yun, hindi na yun early disease. Okay? Once the patient have what you call vaginal bleeding, okay, so these are the what you call telltale signs na may problema na kayo. Okay? Once mag-gerger kayo, tapos mag-spotting or mag-contact, mag-spotting after contact, please have a checkup, because that is a big possibility may problema tayo. Okay? Or kung napansin nyo na may spotting before regular or spotting of regular, irregular spotting or regular menstruation, please check up, because one of the reasons probably is cervical cancer or other types of one, and sometimes spotting after menopause or discharge after menopause. Okay, so we have to talk again with regards to yung menopause na menstruation, Doc Shi, kasi marami kasi ring what you call misinformation regarding yung regla ng menopause. Okay, so we have to tell everybody average po na mag-menopause yung Filipinas is about 48 to 51 years old. Mag-menopause na yun, so ibig sabihin yung bigla nang mag-stop yung menstruation nyo. Or sometimes pero once mag-change po yung pattern ng regla nyo, yung maglayag kayo or mag-interval ng 2 months or 3 months, mag-usap, then magregla naman kayo, or yung ngayon supposed to be yung regla mo 2 days maging 5 days, okay, or maging yung parang heavy na magpasador na kayo or mag-diaper na kayo, hindi po yun normal. Okay, hindi po yan always menopause. You have to have check-up with doctor because baka may problema tayo sa kwelyo ng mattress, or may problema tayo sa yung lining ng mattress, yung tawag nating endometrial cancer, or baka may myoma or whatever. Hindi po hindi, wag niyong sabihin, menopause lang po yan, or myoma lang. You have to have check-up because we have to investigate it. Your doctor, your OB will have to investigate. Like Dr. Shi, what does is yung pina-ultrasound niya, pina-check niya yung kwelyo mattress, pops me like that, para masigurado talaga kung may problema wala. So again, please go to your nearest OB-GYN or yung doctor. Huwag po kayong makinig huwag kayong makinig sa marites or yung sa mga what you call that, sa mga lola or sa
Solera.
ganun, kasi it's not always true. The best person with that is you have to consult is your doctor with regards to your health and well-being. So you have to go there. Okay? So one of the characteristic, Doc Shi, with regards to is yung tinatawag nating watery, bloody vaginal discharge that may be heavy or have a foul-smelling odor. Okay? So in layman's term, yung sa Bisaya, ang tawag namin noon is yung hinugasan sa isda. So in Tagalog, what you call that, Doc Shi?
Naku, hindi ko alam.
So basically, how we describe it is
yun na.
yung how we describe it is yung discharge. Yung discharge yung po parang langsa ng patay na na isda or whatsoever. Parang masangsang talaga amoy. Hindi po yan normal. That is very characteristic po of a cervical cancer. That's why may karang malangsa na discharge, please have a checkup. Okay? At
sabi ni Rizal, mas malansang sa isda.
Okay. So, yun po so yung tinatawag ng fish wash discharge or parang hinugasan sa isda or parang langsa na isda, like that, yun ang very characteristic description of a discharge of cervical cancer. Okay? So, kailangan mong simhutin nyo yung katapin nyo ngayon kung may ganong klaseng. So, pa-check up po kayo, ha? Iba na yan, baka ano pa yan. Okay? Another of the yung description ng symptoms ng cervical cancer, tinatawag na pelvic pain or pain during intercourse or masakit yung puson or balakang, or parang napansin yung parang sakit na palagi yung balakang ko, yung matagal ako makatayo or nakalakad or nakaupo, parang numbness or tingling pain, or sometimes yung ibang description ng iba, Doc Shi, is yung pain na parang kuryente na from balakang, from hips going to the thigh, yung sa paa, yung sa baba. Yun po ang characteristic, tinatawag naming electric type of pain. That's very characteristic also already advanced cervical cancer. Okay? So, sino bang who are at risk? Okay? So, everybody is at risk. Okay? All women are at risk except yung mga madre. Okay, I have to be frank with that. So all those who practice sexual intercourse or nag-gerger is at risk. Okay, up to 80% of women affected with HPV at some point of their lives. Up to 50% of women will still be infected with cancer-causing strain of HPV at some point of their lives. So everybody is at risk. So maski gaano kayo, maski anong level kayo ng society, group A, social ba kayo, or yung sa group DC, or yung sa mababang kuan lang category, everybody's at risk. So we have to be careful with that. Okay? So how do we screen? Okay, how do we screen cervical cancer? So you have to have regular screening. It's the only way to detect precancerous lesions. or early signs of cancer, make it easier to treat successfully. Ang problem kasi ng screening is all screening is not 100%. Okay, all screening is 100%. That's why kung may symptoms kayo pabalik-balik na i-check up ng doktor, treat doctor kasi they are looking for any other reasons bakit iba yung presentation mo. So yung as mentioned, yung screening kasi sa Philippines is that we still have yung national screening recommendation natin is still parang on the go or on development pa rin. Pero yung latest recommendation, yung tinatawag namin yung success program ng GPIGO na i-adapt ng Philippine OB-GYN Society ng OB-GYN Society led by Dr. Efren Domingo, which is I was one of the co-chair, president co-chair. That's a problem now that we have to adapt to yung WHO recommendation, yung tinatawag nating HPV DNA screening testing. Okay? So yung HPV DNA testing, Doxy, is para ring pap smear, okay? Para naka-positionin kayo, kuha kayo ng smear ng quelling mattress, pero hindi po yan smear ng sa slides o gano'n. O, iba yun eh. Yung kuha na yun doon, tapos ilagyan namin sa special liquid. Okay? Yung liquid, parang medium yun, parang transport medium. So dalhin yun sa machine, i-process ng machine para to detect the HPV virus. Okay? Yun po ang HPV DNA testing or screening for cervical cancer. So ang dalawa lang yun ang lalabas na results. It can be positive or negative, okay? So pag positive, automatic yung success program namin, yung sinasabi ko is automatic na mag-treat kaagad kami. Okay? Pero tingnan natin kung hindi ba gross lesion. Kung hindi gross lesion, yung criteria for treatment, yung less than 75% involvement, all areas are seen, then we treat with yung tinatawag ng cryotherapy or thermal ablation. Okay? But if there is abnormalities, then we have to do biopsy first to check if this is already cancer already. So yun po ang talagang ang main promotion namin. Bakit nag-shift tayo to from pap smear. Yung pap smear kasi sa before natin. Yung panahon na nyo, Doxy, pap smear yun. Sa panahon na namin, HPV na kami kasi si Doxy kasi senior ko before yung training namin dito sa Perpetual Socorro Hospital. So yun po ang bakit nag-shift tayo, okay? For first reason is that it is more accurate, okay? So mas sigurado tayo na positive, it means it's really the virus is really there, okay? Secondly, if negative po yung HPV DNA testing nyo po, after next 5 years pa po kayo next mag-screening. Okay, kasi based on studies, nakita nila yung pag infection o pag negative pa, any change or development, it will take 5 years pa na yung in next interval na ma-detect kung may problema wala. Unless may symptoms kayo, then they have to do it earlier. But otherwise, yung regular lang po, 5 years po yung interval natin screening. That's how it is accurate and it is more reliable. So mas ang problem na it's a little bit expensive ng konti, okay? The latest I asked, we have I think it's only 2 or 3 institutions here in Cebu. That will be UC Med, Chonghua, and I forgot the other one. I'm not that sure with regards to Cebu doctors, pero last time they mentioned meron, pero depende lang yun sa yung cartridge kasi yung tawag nila. Pero definitely, I just talked with Dr. Dorsera that meron daw sa UC Med. So you can ask your OB-GYN, Doc, HPV DNA testing po kayo. So lahat ng nakikinig, kung may budget tayo, I would suggest you do sabihin nyo sa OB nyo, HPV DNA testing. Ang gagawin na screening for cervical cancer because it's more accurate and you have to do it every 5 years pa. So sure tayo na lesser chances regarding cervical cancer. As mentioned, medyo konti, expensive lang ng konti. I think the last was 3,500. The test kit alone na the test kit. So the other things, yung consultant, yung added yan na cost ng yung sa iyo. Pero it will still be more, as mentioned, we still recommend the first line is talagang HPV kasi mas sigurado tayo. So talagang nakikinig, please tell your doctor, okay? Okay. But so when does kailan tayo mag-start nito ng screening, okay? So nakita nila as mentioned cervical cancer rarely develops less than 25 years old. Okay? Less than 1% chance. Unless kung may symptoms na kayo, then you have to get checked early. But otherwise, the recommendation starts at 25 years old. Pero kung 25 years old ka, kailangan mo, may history na pa kayo ng sexual contact or may history na kayong gerger. Okay? So yun po, mag-start tayo ng cervical, yung HPV testing. Then that will be every 5 years up to 65 years old, yung American recommendation. Pero as mentioned, dito sa atin, hindi tayo mag-stop ng 65 years old as long as yung pasyente lumalakad pa or buhay pa in the next 5 years, we have to continue cervical cancer screening because based on studies like in local studies na yung patients lang namin sa Perpetual Hospital o sa Chong Hospital man yung nakita namin, 10% of our patients are more than 60 years old. So, it doesn't mean na kung menopause kayo, lahat ng nakikinig na menopause, raise your hand. Okay. Hindi po ibig sabihin na yung last journey nyo 10 years ago, hindi na kayo magka-cervical cancer, okay? As mentioned, the virus will still stick in the cervix and it will develop after mga 5 years, 10 years, 15 years. That's why you have to continue cervical cancer screening, maski 65, maski 70 years old kayo, kasi may pasyente rin kaming still beyond 60 nagka-cervical cancer pa rin, okay? Kasi yun kasi ang problema natin yung pag mag-screening tayo, sabihin ng mga pasyente, Dok, menopause na ako, matagal na akong walang contact, wala na kaming journey ng partner ko, ng husband ko. No. You still have that because you have the exposure. Once you have the exposure, you have sexual contact, the chance of exposure to that virus is still there. And we are not 100% sure if that you have a persistent infection or na-clear out na ng system. That's why you have to continue cervical cancer screening. Okay? Unless, exception. Ito po yung mga exception. As mentioned, kung wala kayong sexual contact. Okay? Kung virgin pa kayo, pero yung bibig... pero yung...
Ayusin nyo.
Just a joke. Okay. Never mind. Okay. Basta may history kayo ng sexual contact, you have to have that. Ang exception, as mentioned, kung wala kayong history of sexual contact or may yung naoperahan na kayo. Okay? Parang tinatawag na tabso na kayo or na TH or natanggal na ng mattress, including kuwili ng mattress. Basta yung biopsy na yon or yung it was not done for a precancerous lesion or for a cervical cancer, you don't need to do to have pap smear anymore. Okay, as long as you don't have it was not, as mentioned, not done for a precancerous lesion of cervix or cervical cancer, or no history of abnormal pap smear during the probably within 5 years from the surgery, you don't need screening anymore. You don't need pap smear, you don't need cervical cancer screening because wala na yung quillian mattress. Okay, so yan lang po ang exception natin na hindi tayo mag testing. Okay, so again, I have to reiterate it to lahat ng makikinig, mga kabayan, kapatid, kapamilya, kaklase, whatsoever. Okay, you request from your OB the HPV testing. We have it here in Cebu. In major cities, we have it. I'm not that sure with other provinces. I'm not that sure it's in Dumaguete. I'm not that sure. I'll ask my friends there if they have the HPV testing. Yeah, meron daw sa I think SUMC. Meron daw sila doon sa SUMC. Okay. So that's the first type of screening. Okay, let's go now to the old type. So panahon ni Doc Shi, yung ginagawa namin yung pap smear. Okay, so pap smear, maski second line or maski hindi siya top priority na cervical cancer, still very effective. Especially not, as mentioned, not all locations, not all cities, the machine that does the HPV test. So pap smear is still reliable. You just have to have the regular checkup. Okay. The recommendation in regards to pap smear is that The American recommendation is they start pap smear as mentioned 30 years old or 30 years old every 3 years. Okay, but in the Philippines, because it's not always accurate, there are plenty of kind of what you call false negative or not always that because of the many factors that will cause false negative results. We still recommend annual pap smear. Okay, if it probably liquid based, you can do every 2 years, yung tinatawag na liquid-based technique. But kung yung conventional, which 80% of us does, is we still have to do it every year just to make sure. Unless kung may yung presentation na iba talaga, may duda talaga yung doctor, they have to do it frequently or do other tests to check if the pap smear is really negative. Okay? So still same qualifications. So another one is what you call visual inspection of acetic acid or what you call VIA. Okay, so this is what we do. Itong most we do in yung outreach natin. Okay, why is this in India, in third world countries? This is the first form of cervical cancer. Why? Well, bakit? Okay, because it's very cheap. Okay, it's very cheap and it can be kailangan lang ng training, magandang na-train kayo kung anong titingnan, anong positive and negative yung gumagawa nito. So, one of our supposed to be supposed to be yung tinatawag natin yung programs na Dokshi was to have kanang parang standardize natin yung training regarding VIA. I was
Yes.
thinking of doing standardization to all doctors and to all residents like that. All this. Unfortunately, sobrang sobrang busy talaga hindi magawa ko yan the last 2 years. Well, hopefully I can find ways that we'll have to standardize
Yes.
that. Okay. But definitely, ang good thing kasi nito, yung sa provinces nating outreach like that, it's still very effective. Okay. Second, effective if you are trained with that. Like Doc Chi, magaling na ito siya kasi palagi natin ginagawa nito. Pangalawa is that we have that i-pair natin yung tinatawag natin SVA or single visit approach. Kung may problema, may positive, may whitish area, automatic treat ka agad. So, hindi na kailangang pabalik-balik pa yung pasyente. So, yun ang good thing nitong BIA is that we can do treatment the soonest because we know there's something wrong, there's positive, then treat again. So, yun po ang good thing ng SVA or single visit approach with using visual inspection of acetic acid. Another one is what you call colposcopy. So colposcopy is the next hierarchy, yung parang last line of defense with regards to investigation of precancerous lesions. So usually we do this. It's what you call use of a special microscope. May high-dense light, may monitor tayo, makita natin kung may gagawin tayo ng mga acid whitening, like that. Tingnan natin yung mga yung mukha ng quilling mattress, yung grains niya, yung parang tinatawag ng vessels, yung changes ng vessels, makita natin kung may abnormality din. It will give us what you call guided biopsy. Yung sabi ng mga doktor, no, kita lang ng doktor kung saan talaga mag-biopsy para to make sure the findings are accurate and make sure it's really positive or really negative. What you call confirmatory test if there's abnormalities. Okay. Usually what we do colposcopy if there's abnormal pap smear or there's a positive HPV DNA testing, we want to make sure anong klaseng infection yon, anong level ng abnormality. And sometimes as mentioned, Doc Shi, is that not all screening are 100% accurate. So kung may duda talaga doctor, so lahat ng nakikinig, sometimes doctors request that if the clinical presentation, yung negative pap smear, yung clinical presentation mo, may discharge, mag-contact, mag-spotting, then we do colposcopy to confirm kung may problema ba o wala. Okay?
So, sa mga
in
inconsistent.
general, yes, in general, the management of cervical cancer encompasses yung surgery. Usually, we do surgery for if the lesion, yung mass is less than 4 cm, walang other involvement, walang nodal spread like that, we do surgery. So usually stage 1B2, we can, or 2A less than 4 cm, we can still do surgery. Good thing with surgery is that immediately yung abnormality, yung bukol mo matanggal natin. Yun ang advantage niya. Pero once may extension na or beyond, more than 4 cm na or beyond, stage na more than 2B or 3B like that, which most of our patients are seen like that 3B already. So they have to undergo radiation, chemotherapy, brachytherapy. So those three are the main components of treatment for advanced disease. Okay, so that's why we the as mentioned, even how good the machine is or the treatment is or the chemotherapy is, the chance of cure is not always 100% if it's already advanced disease. That's why we have to emphasize to the listeners that early detection, early screening, na makita na precancerous lesion pa lang or early disease stage 1 pa lang, your chance is very, very good, almost 100%. That's why, as mentioned, early stage, early treatment, good outcome po yan. Okay. Sorry. May sore throat ako. Kaya yung yung, so this is how cervical cancer. Tingnan nyo po, yun po yung mattress. Yung sa dulo po ng mattress, yun po ang bukol na natawag natin, cervical cancer. Okay. So how do we prevent? Okay, so prevention, okay, as mentioned, prevention is better than cure. Okay, so kung ma-detect natin, hindi na tayong maghintay pa na magkaganon tayo, we have to protect ourselves. So, okay, primary prevention is abstinence. Walang contact, walang gerger. Pero mahirap yan. Sabi ni Doc Shi, mahirap talaga yan. Nagkuhan yan sa, yung sa last namin na conference, nag-raise arm si Doc Shi, tumindig talaga siya, hindi pwede. Di ba siya kasi nag-wild ka doon? No, we have to be, let's be frank, okay? Let's be frank. We have to, let's be, if you are a married couple, it's part of your married life, okay?
Currency ng love yan.
Mag-asma ko din. No, that's part of what we call sharing life, love, whatsoever. Okay? That's part of married life. Okay, but that's why it doesn't mean. But we have to protect. Okay, one of these is a use of vaccine. Okay, so as mentioned, we have already the HPV vaccine already. Do you know, lahat ng nakikinig, there are only 2 vaccines that can prevent cancer. Okay, the one first is the hepatitis vaccine, can prevent liver cancer, and second is the HPV vaccine that can prevent cervical cancer. Okay, so anong what can you say about yung vaccine? Anong narinig mo niyan regarding vaccine, Doc Shi? When kayo mag-start ng vaccination?
So, talaga, sasagutin ko, Doc? Oral recitation pala ito? O sige. Sige, primary prevention. So, dapat before nag-start ng sexual contact. Yun yung ideal. Kasi primary prevention.
So kaya before sexual contact, yung recommendation talaga starts at 9 to 15 years old. Yun talaga ang bulk ng supposed to be prevention natin. Okay? So kung sino may anak dyan, okay, please start them earlier, start 9 years old. So alam mo ba, Doc Shi, na may libre tayong HPV vaccine? Okay? May libre tayo sa DOH, may libre tayo sa Barangay Health Center. Initially, yung 3 years ago, 4 years ago, yung before the pandemic, we have it school-based, okay, school-based vaccination. But during the pandemic, they shift it to community-based kasi wala namang klase tayo. So, ang problema kasi natin noon is that pag-shift ng community-based, ang nahirapan yung mga barangay health worker, yung mga nurses, midwives natin nag-vaccine kasi iikot pa sila lahat, okay? So that's why now may verbal communication kami ng DOH na ibalik talaga to school-based immunization. Kasi captured patients yan yung mga 9 to 15 years old, yung grade 3, 4, 5, pwede natin yun ma-vaccinate. So, sabihin nyo kung, it's available in government, what you call that? In government schools, just tell your teachers to coordinate with LGU, with the nearest barangay health barangay centers to have the vaccination in your school. Or kung hindi, pwede tayong tinatawag natin mag-group yung PTA natin, yung Parent Teacher Association. You can initiate that na meron mag-request tayo ng LGU, yung sa barangay, na i-vaccinate natin yung mga estudyante natin. Start at 9 years old, okay? So again, as mentioned, Doc Shi, so we give it before yung exposure ng virus before sexual contact. So that's very effective. Second is that nakita namin pag mag-early ng bigay ng vaccine, yung antibody titers kasi ng mga bata is mas mataas. Okay, sobrang taas compared to yung may edad na, yung 20 or 30 years old, yung antibody titer hindi as gaano kataas yung compared sa yung mga bata. Okay, so that's the two reasons talaga na bakit binigay natin sa 9 to 15 years old. Okay, and ang pangatlong reason yan is that dalawa lang ang dose na ibigay pag less than 15 years old. Okay? That will be ngayon and 6 months to 12 months after. So nakita na it's very effective even 2 doses for that age group. But anybody beyond 15 years old, yung 16 pataas, they should have 3 doses of the vaccine. So that will be ngayon, 2 months, and 6 months. Okay, so yun po ang ang kanang yung scheduling bakuna natin. Okay, so initially, yung paglabas talaga ng vaccine, so I was one of the part of yung parang assistant investigator namin sa yung timing natin yung training sa PGH. Ako yun, ang kuha namin yun is that ang population namin is from Tondo. So from Tondo, ang rami namin yun, mga teens na na-vaccinate namin. But I think we were able to vaccinate 3,000 for that study. And they noted it was really effective during that time. Okay. So anybody beyond can still have the vaccine. Studies have shown that we can still give at 45 years old. But personally, sa akin, I would still recommend beyond 45 years old as long as you have exposure to the virus, as long as you have history of sexual contact. Basta buhay ka pa the next few years or may budget, I would prefer to have the vaccine even beyond 45 years old because definitely, even though you have exposure already, it's not 100% effective. It definitely it will help. It will help talaga for protection. But mind you, even if you have the vaccine, it doesn't mean you don't need screening. You still need pap smear, you still need Sweden testing, you still need cervical cancer screening. Okay. Excuse me. So secondary prevention, so na-discuss natin ito. So yun po yung screening, early detection, diagnosis, treatment of HB-associated cervical precancerous lesions, yung pap smear, SVDN testing, yun po ang tinatawag natin secondary prevention. Okay? So primary prevention, can you give some tips to our listeners regarding yung part of tanungin talaga nila is yung part sa lifestyle is yung habit ng eating. What can you say about
the eating habits?
may mga specific na foods ba na it will help you boost your immune system and prevent any development of cancers?
Correct. So sa mga pagkain, Doc, I always recommend to my patients whole food. Kasi pag na-process na ang pagkain natin, may mga oxidative stress.
Can you expound that? What do you mean whole? Yung isang litson, yun bang sinasabi ng food? Walang per kilo niyan?
Hindi siya natadtad. Okay. Kunwari apple. Kung ano siya na-pick sa puno at yan ang kinain mo, yan ang example ng whole food. Kasi kahit kumain ka ng plant-based, pero na-process na siya, kunwari, naging french fries na, ang potato. So, nagkaroon na ng food processing along the way. So, yung pag-process ng food ay nakakapagdagdag ng oxidative stress at yun ang nakakain natin sa katawan natin. So, pag hindi masyadong maayos yung immune system natin at ang antioxidant sa katawan natin, hindi na lalabas natin ng unharmful. So, harmful yung oxidative stress sa katawan natin. Kaya hindi tayo nakakapag-defend against formation of yung from precancerous, hindi natin nalalabanan, nagiging cancerous na siya. So, ganun ka-importante yung food na pinipili natin talaga. Kasi as you can see, more than 3 times a day kumakain tayo. So, saan ba natin nakukuha yung mga...
6 times ko.
Kaya sabi ko, more than 3 times. So, Doc, bago tayo mag-proceed, kasi si Ma'am Daisy, siya yung sabi kong patient ko na nakapag one of those na sumali nung Sunday. Ito yung concern niya. na marami daw takot. Maraming mga parents na takot at hindi sila pumapayag na magpa-vaccine yung mga anak nila. Siguro because may mga balita na hindi nga masyadong maganda, especially from our history sa ibang vaccines. So anong masasabi niyo po about that?
Yeah. Agree. Yeah, that's one of our secondary reasons why we had our yung cervical cancer screening sa DepEd. We coordinated with DepEd because during that event we had lectures to the teachers. Okay, so we have to kasi sila ang frontline natin yung explanation regarding the vaccine. So we have to orient them that vaccine is very effective. Hindi yun po makakos ng cervical cancer. Again, the vaccine doesn't cause cervical cancer or any cancers whatsoever. Okay, it will help protect you against development of cervical cancers. Okay, so yun po ang emphasize namin yung education ng teachers, yung mga frontliners namin regarding na so that they can relay to the parents yung mga questions ng parents, maka-defend sila, maka-answer sila. So yun po ang first namin ginagawa, yung education natin ng teachers, yung frontliners, barangay health workers, yun ang ginagawa natin. So, okay. So, again, we have talks already na yung together with MSD na we have to re-educate or re-change yung protocol from community-based to school-based with regards to HPV vaccination. Again, HPV vaccine is free. Libre po ito. Marami tayong stock sa Philippines, marami tayong stock sa Manila, sa DOH. Unfortunately, yung coordination lang ng LGU na mag-request na mabigyan sila ng stocks para ibigay sa patient. Yun lang po problem. Tapos, secondly, do you know na ang Cebu is one of the lowest vaccination rate with regards to HPV virus? So yun ang problema na how to I understand yung listener natin ng post ng question. I understand it's really true. That's why we have to educate regarding that. Very low. As mentioned, yung marami kasing mga parents na dahil sa dengue vaccine nangyari nun. So, natakot talaga sila. So that's why we have to educate them. Yung lahat ng listeners, kung may mga anak kayo, please please have your children vaccinated sa health center kasi libre po yun. Kasi, just to remind you, kasi pag pumunta po kayo sa private, it's a little bit expensive na po. Cost about 3 to 5,000 per shot. So medyo may kamahalan na. So we have that. It's just a matter of yung requesting natin. Punta tayo sa barangay health center natin or mag-request tayo or mag-group tayo ng yung, together with sino mga president ng PTA dyan? I-project natin to, magpa-vaccinate kayo, ipa-request ng LGU na ma-vaccinate ang lahat ng mga estudyante natin.
For free.
Okay? For free. So yun po, it's just a matter of educating the teachers, the frontliners, and the parents. So next step natin is part of our yung mga yung tinatawag natin ng advocacy natin, yung AHIP, yung andun. Kasi hindi lang yung teens ang educate natin yung regarding sexual health, regarding HPV vaccination. Nag-start na rin si Dr. Rena De Leon, nag-start na rin sila Dr. Dali Yap, nag-start na rin ng education sa mga parents during the PTA seminars online or on-site regarding the HPV vaccine because we have to tell them that the truth about the vaccine, that it's very effective and it's very safe.
So, pwede din po ninyong i-share ang ating health talk ngayong gabi at pwede ninyong ipanood sa kanila kung gusto nilang matuto about cervical cancer prevention. Ayan.
Yeah. May question ako, Ma'am Shi, regarding lifestyle regarding this prevention. Yun talaga ang part ng question ng mga patients ko. How about yung may mga bago kasi tayo mga food products yung tinatawag nating
GMO?
Plant-based burger, plant-based meat. Can you say something about that? Kasi I'm very interested if that is kasi uso na yan sa States Tapos slowly yung makikita ko na sa mga groceries na may mga plant-based na mga foods, pero I'm a little bit hesitant. Is this really true or what? What can you say about that, Doc Shi?
Okay, so gaya ng sinabi ko, potato can be plant-based pero pag naging french fries na, hindi na siya healthy. So kunwari, plant-based, anong example? Plant-based tocino. Galing siya sa plant, pero na-process siya, na-preserve siya, so yung cholesterol content is still there, saturated fat still there, yung mga salt, yung mga preservatives andun pa din. So as much as possible, I discourage that. Hindi po yan
Yeah.
yung banner ng lifestyle medicine.
Yeah, okay. So ang banner talaga, I think the way I understand it, it should be from farm to table.
Correct. Yeah, whole food, whole table.
Whole table. Yeah, I agree. It should be unprocessed, and it should be yung as much possible yung farm to table talaga na yung mga foods natin, yung mga plants, yung mga gulay natin o vegetables whatsoever, yung fruits. Definitely it will help. It is yung natural protection ng immune system natin, yun is mas ma-achieve natin kung yung fresh talaga yung mga fruits or mga gulay na kinain. Yeah, I agree with that. It matters talaga. Okay, thank you for enlightening me, Doc Shi. But I was long thinking of how to ask you about this. Makita natin sa mga freezer ng sa mga groceries. Bago pala ito. It's a little bit expensive pala. It's a little bit
Opo.
expensive than the regular. So, yeah, to the listeners, it will be more cheaper to get directly from the market, and it's more
Correct.
sure tayo walang tayong mga yung yung mga contents na hindi maganda. Okay.
So, Ate Mary Jean Doc is a culinary medicine chef, and sabi nga niya, we really have to check the ingredients and the additives na nasa commercialized plant-based food.
Yeah, I agree with that. Okay, because definitely during the transfer or the preservation, that there are things added as additives in that might not be as good as yung fresh talaga natin. Okay.
Okay,
So,
ayan.
so let's go now to cervical cancer. Again, this is a major breakthrough in cervical cancer prevention. As mentioned, this is a second vaccine that prevents cancers. So contains protection causing cancer causing HPV, usually common natin in 16-18, and sometimes there's what you call cross protection, the other type of HPV. So as mentioned, Doc Shi, so initially, ang first talaga lumabas na vaccine was the two types of serotypes. So it was letter C na brand. So yun talaga ang kanang unang lumabas na vaccine. Then
Magpa-sponsor dapat tayo pala.
oo, may sponsor tayo yan. No, never mind. Iba na yun. So, yung bago, yung second vaccine was the four types, okay? Yun ang lumabas, yun ang mas effective kasi it covers not only its cervical cancer causing vaccine and also the wart causing virus, okay? Now, yung lumabas na tayo ng 9 types of virus, okay? I've heard, but it's still not yet commercialized here in the Philippines. In the States, they have already the 12 types of serotypes of vaccine that prevents cervical cancer. So hopefully, it will reach our shores. But whether you have the vaccine or not, as mentioned, you still have to have the cervical cancer screening. So both
Okay.
ideally should be present, the vaccination and screening. Okay. So as mentioned, ideally given before sexual debut, but maybe given to women beyond 9 years old, ideally 9 to 15 years old, even uh, even si lola, si nanay, sinong nandyan sa bahay, can still have the vaccine as part of their protection. Okay. So in summary, in the Philippines, cervical cancer is the second most common cancer in women, next to breast cancer. HPV or human papillomavirus is a necessary cause of cervical cancer. Every woman is at risk. Okay, every woman, every one of us. Okay, is at risk of. Oh, I just got this. Every one of us. Okay, lahat ng listeners, HPV virus cannot only cause cervical cancer. Ha? So, yung lahat ng mga lalaki dyan nakikinig, the HPV virus can cause also penile cancer. Ha? Yung penile cancer can cause HPV. It's really related to penile cancer. It can cause also throat cancer. Okay, we all know that think Michael Douglas has throat cancer, and he was treated for that. It was HPV related. So yung unusual sexual practices can transmit the virus to the throat. Okay, and just uh, eye opener to our friends that are to our third sex friends that are practicing M2M sex or M2M relationship that does anal sex. The virus can be found in the rectum and it causes rectal cancer. Okay, so lahat ng mga kaibigan natin ng mga laki ng does anal sex can cause anal cancer. So kung you does that, you have to have checkup with your I think the gastroenterologists are not not familiar with that. The colon surgeons are not that much familiar with that. But you can try look your gynecologist or OB/GYN to have to have what you call rectal smears or anal swab smears. That's part of the screening for in development of any rectal cancers. Okay. So, virus is transmitted through genital skin to skin contact. It's not always penetrative is needed. Condom does not offer full protection. Vaccination alongside screening provides the best protection against cervical cancer. Again, vaccination and cervical cancer screening primarily. HPV DNA testing is your best protection you can have. Cervical cancer affects lives, okay? Affects not only women affected by the disease, but also other families as well. That's why we have to protect our ilaw ng tahanan. That's why we have the lantern walk, because we have to protect the mother of the house, mother of the family. Okay. Okay. Again, cervical cancer kills women every 2 minutes in the whole world. That's how rampant it is. Have yourself HPV testing or pap smear or VIA. Ask your doctor for the vaccine that can best protect you against cervical cancer. Okay. That's all, Doc Shi. What are the questions we have?
Meron tayong question, but before that, kasi nag-promise po ako na magbibigay ng free online consultation. So, please prepare na po, kasi paunahan ng pag-type ito. We are at our segment of... Okay, tama o mali? Okay, so you will just type tama.
Tama. Mas gwapo po, mas maganda po si Doc Galbo kay Doc Shi.
Okay, so ayan na, ready? Okay, kasi again, ito pong free online consultation coupon natin. Kung hindi, feeling nyo naman, hindi ko kailangan, Doc, I feel so healthy, you can share it with others. So ayan, kailangan lang po ay mauna at tama ang sagot natin. Okay, ready, set? So for the first tama o mali question, tama o mali? Kapag na-vaccina, pwedeng hindi na magpa-screen. Again, kapag na-vaccinate na ng anti-cervical cancer, pwedeng hindi na magpa-screen gaya ng pap smear. Tama o mali? Wow! Congratulations talaga! The birthday girl was able to answer immediately. Ang galing. Congratulations, mi amor, for answering it correctly. Ang answer, Doc, ay...
Mali. Okay, so again, even if you have the vaccine, you still have to have the screening, okay? Because both should be present to add protection for development of cervical cancer. Okay, as mentioned, the vaccine is not 100% effective. Okay, the 9 types of virus, if given at 9 to 15 years old, covers about 80 to 90% protection. Okay, so it still have about 10 to 20% chance of developing cervical cancer. That's why you still have to have the regular screening. Okay, HPV testing is the recommended. If not available, then pap smear or VIA.
Ayan, thank you. So again, ready? Because we are down to our second tama o mali question. Second question, tama o mali? Condoms can fully protect us from cervical cancer. Again, tama o mali? Condoms can fully protect us from cervical cancer. Ready, set, go. Wow! Ang bibilis sumagot. Congratulations! So, Lorna Ternida Cueto. Ang sagot niya ay mali. Ano po ba ang tamang sagot, Dr. Galbo?
Okay. So, tama po pag ang condom sinuot niyo po from head to toe. Okay? Pwede yan, protected po yan. Pero unfortunately, yung condom po is para lang po sa genital ng lalaki or sa yung may condom rin tayo sa babae. So, mayroon pa rin exposure sa lateral side, sa vulva or sa gilid ng penis, like sa lalaki sa genital organ. So, it can still transmit the virus. So, with regards to protection to have prevention as kanang yung tinatawag natin contraception, it's 99% effective, but for prevention of transmission of HPV virus, it's not fully cannot fully have protection. So the answer is mali. Congratulations.
Congrats. Okay. So we are to our third tama o mali question. Ready? Tama o mali? Pwedeng walang sintomas ang early cervical cancer. Again, tama o mali? Pwedeng walang sintomas ang early cervical cancer. Tama o mali? Wow! Ang naunang mag-answer ay estudyante po natin, Dr. Galbo. Jesh, ang sagot niya ay tama. Dr. Galbo, ano ang tamang sagot?
Okay. Ano yung question? Sorry, nawala ako sa passing. Ano yung question? Sige, pwede ko lang siya. Okay, yes, okay. The answer is tama, okay? So, early disease, yung precancerous lesions, wala po yung symptoms yung pasyente, okay? Walang naramdaman. Once the patient have symptoms already, yung sinatawag nating fish wash discharge or parang hinugasan sa isda, it's already ominous sign that we have a problem. So that's why maski wala kayong naramdaman, you still have to have your annual checkup or checkup with your OB to have the cervical cancer screening. So again, the answer is tama. Pwedeng walang sintomas ang early cervical cancer.
Wow! Congratulations sa ating mga winners sa Tama o Mali segment. So before we end, Dr. Galbo, may mga burning questions.
Okay.
Ay, opo.
So,
Dagan?
I can offer one shot of the quadrivalent vaccine to Doc Shi to those who can answer. One shot lang. One shot lang. Medyo may kamahalan yan eh. One shot lang for tonight's con. Those yung nakikinig. Okay, for tonight's. One shot of the quadrivalent vaccine. I'll give it to Shishi on Sunday. And those who can first answer tama o mali will get that as a prize. Okay. That costs about I think 3,500. That is for those who can have those. Thank you, Doc Shi. Thank you for everybody who is listening now. So this is the question. Okay, the question goes as this.
Serious yan?
Nag-iisip ako. Sandali lang. Nag-iisip ako. Okay.
HPV vaccine talaga na question. Pang Miss Universe.
HPV vaccine talaga. Okay. Okay. Menopause women do not need HPV vaccine. Tama o mali? Menopause women do not need HPV vaccine. Tama o mali?
Okay, ayan. Tama o mali? Ready, set, go! Ayan. Ang naunang magsagot. Oh my gosh, talaga. Ang bilis ni Daisy Jane. So, ang tanong kanina ni Dr. Galbo ay, menopause women do not need HPV vaccine, at ang sagot sa nauna si Daisy Jane is mali. Anong tamang sagot, Dr. Galbo?
Okay. So again, vaccination is usually primarily recommended to 9 to 15 years old. We have catch up to 25 years old. Even studies goes at 45 years old. But still personally or in general, for your health and well-being, if you have exposure to the virus, of you have a history of sexual contact, as long as you're still alive, you're still breathing, we still recommend that you have the HPV vaccine because, as mentioned, 10% of our patients seen in the clinic or in Perpetual or Chong Hospital are more than 60 years old. So it's still recommended to have the vaccine. So congratulations, Ma Messi Jane, okay, for winning the one dose of the quadrivalent vaccine.
Oh, why
And we'll
not?
give it to Doc Shi. She will be the one who you get it from Doc Shi. Have the vaccination, Doc Shi. So during that time, you can have a checkup also with Doc Shi. Okay, congratulations, DC Jane, for answering quickly that question.
Wow. Thank you very much, Dr. Galbo, for your generosity, not only for your time and your expertise, pati yung shot. Naging generous pa. Thank you very much as always for being with us tonight. You might want some before we end, no? Ano bang last words natin sa ating audience bago mag-end ang Dangpanan?
Okay, again, cervical cancer can be prevented. Okay, you can just have the vaccine. Ideally, should start at 9 to 15 years old or beyond. Okay, and you have to have regular checkup, pap smear, starting at 25 years old. Ideally, if you have the budget or you ask your OB/GYN doc, please get me HPV-DNA testing. Then that's the primary testing for cervical cancer. If not available, then you can do regular pap smear, or in a setting of outreach programs or missions in the province, you can ask for VIA cervical cancer screening. So, as mentioned, cervical cancer is preventable. It can be cured if only detected early or diagnosed early. Definitely the chance of survival or chance of complete response or what you call cure is very high as long as seen early. Again, thank you, Doc Shi. Thank you, Dr. Shi. Siya po ang aking mentor with regards to lifestyle health. Okay. Alam niyo ba na siya pa rin ang backup speaker yung sa GMA na kapag umahal ko na segment namin every first Sunday. So sometimes tinatawag namin kasi hindi ako available. So yun. Again, Doc Shi, Dangpanan to all listeners, thank you for being here and thank you for listening with regards to awareness. And if you are available this Sunday, that will be this 28th, 4:30 p.m. We'll see you at the outside Pedro Calungsod. If it's not raining, if it's raining, then it will be in the mountain wing area of SMC side Cebu. We'll have our cervical cancer, Scarlet May cervical cancer awareness and the lantern walk. Thank you and see you all.
Thank you. Okay, thank you, Dr. Galbo. Sa susunod na naman po at next year. O yan, may next year na tayo.
Next year. Oh, by the way, next year, I'll see you in Albuquerque. I promise you I'll be there to help with regards to cervical cancer screening, and hopefully we can bring the thermocoagulator and with regards we can have the automatic treatment there. So Albuquerque, Bohol, I'll see you May 2024.
Okay, thank you, Dr. Galbo. So I will have a few moments with the audience and then mag-i-end up po tayo. Thank you, Doc.
Thank you. Bye-bye, Doc Shi. Thank you everybody. Bye-bye.
Oh, ayan. So again, just a reminder for everyone, sa Sunday na po ito, ang Lantern Walk. It's an awareness walk that we are fighting against cervical cancer. 4:30 p.m. po sa Pedro Calungsod. Pag uulan, SMC side po, Mountain Wing. Ayan. Alright. So, nag-thank you po ang maraming audience. Ayan, thank you po. You're welcome. Thank you for being with us tonight. Ayan, sabi, avail the free. Oh, ayan, nakapag-free HPV DNA testing and now may shot ka pa. O, di ba? If you as much as possible kasi I post yung mga activities ng POGS sa aking Facebook page. So para po updated po ang lahat, yung mga activities namin andun po. So after nito, I'll be posting the reminder for the Lantern Walk this Sunday. Ayan. Okay. Yes, thank you po. Ayan. Okay, thank you. So we have come to an end. Sorry, nag-excess po tayo, pero we enjoyed naman, no, our time with Dr. Galbo. Again, thank you very much everyone for being with us tonight. Nasan man kayo, maraming salamat po. And because we always push for a healthy lifestyle, remember, it's not just medicine, it's also lifestyle. Magandang gabi, and I'll see you in the next DANGPANAN episodes. Goodbye!